Well, thank you very much. I'm going to do this half on this and half because I don't trust my eyesight for that teleprompter way back in the back room. So first of all, thank you so much to Catholic Health Association for just the amazing award. It's the video as well too. You know, we've done several videos, and this by far I think captured really everything of what our program is truly about. A special thank you to our Catholic Health Initiative system for all the support that they've given us. I know Kevin's here, and especially all of our other Catholic Health Initiatives Award recipients. And definitely a shout out to our North Dakota, Minnesota division and our Senior Vice President, Jeff Drop, who's been very supportive of us as we've continued this journey. You've seen it in the video, thanks to our opioid team. I mean, it really is an unbelievable team that meets on a monthly basis. It's just incredible the work that they do, the selflessness work that they do. And then definitely a special thank you to our Franciscan Sisters of Little Falls, the history, the heritage, the legacy that they've given us to carry forward. And I feel proud that I think we're doing the work that they would be doing themselves too. So I'm a little off script because that's the first time, thank you. That's the first time we've seen that video, so I'm kind of going to have to ad-lib the rest of this, so just bear with me a little bit. But that video depicts exactly how our program is. When we first started, like it showed, we're a population in a county of about 30,000 people, and on any given month we had 100,000 opioid pills in our county. How many of you live in a community that has over 1 million people? Do the math. That's what's floating around, and the realization is probably 50 to 60% of those pills in your communities are being diverted. They're being abused, they're being sold, they're being traded for other drugs. And so we knew right away, just like Drs. Heather and Kurt commented on, we were seeing the overabundance of the refills in the clinic. We were seeing the overdoses in our EDs. We were seeing the deaths by our EMS services and our law enforcement. So we knew we had to do something out of sheer necessity. So that video and everything that was shared really is 4 years of hard work. So we were doing this before this crisis became mainstream. So I think that's something that we're pretty proud of as well too. When that drug task force started, everybody around the room had an equal part. I know our name goes on this award, but it truly is the law enforcement, the public health, the social services, schools, social workers, you just name it, the pharmacies. To have a pharmacist in that video helping take care of an opioid epidemic when he knows that's cutting into his profit margin, that's a huge step forward for our community. I don't think many people would do that. And then, of course, too, definitely have to thank Kathy up here, who is in the history and the legacy of our sisters. She begs for money nonstop, so she would make a lot of our sisters very proud, and she's very successful at what she does. So, definitely a thank you to her. The two physicians in the video who couldn't be here, I was asked to come accept this award, and to be honest, guys, I just stay out of the heck of people's way. I mean, I can only add my support and moral support for the job that they do, but the two physicians in the video have really changed the culture of our entire physician practice, primary care, surgery, orthopedics. It's amazing, and I think it's one thing to change culture when you're talking about just protocols and processes and procedures, and hey, maybe don't prescribe that much, and hey, maybe taper this person off a little bit. But when you're having to change the culture of getting the rest of your clinic acceptable with the fact that you're going to have, addicts, excuse me, but knowing at some point that you're going to have to be treating addicts as part of primary care. And I think fast forward 5 years from now, I think that's definitely what we're going to see. We're going to see our primary care physicians, just like our two physicians are doing right now, of helping educate others on Suboxone, especially in rural areas, so that we're going to be helping with this opioid crisis, just like it's diabetes or heart failure or COPD. It's just going to have to be naturally what we do as primary care clinicians, and especially doing that outside our walls. But those physicians are the most unbelievable, passionate people you'll ever come across. They're just as good of people as they are physicians. Dr. Heather Bell, who you saw in the video, actually delivered our third child. She's a really good OBGYN as well, too, so she's got a lot of other... And the verdict is still out on our third child, but we'll see how that turns out. To sum up a couple things really quick without taking too much time, I really do, our program started out a necessity before all this stuff became relatively mainstream. And so I think we've really got a fine-tuned, well-oiled machine that is scalable, replicatable. We're taking into other communities in Minnesota. We're helping them change their communities and really taking our mission outside of our four walls of our hospitals and clinic, which is what I think all of us can agree we have to do nowadays. But I would say I really feel the success of our program is two things. It's our mission. This aligns exactly with our mission, taking care of the poor, the vulnerable, those on the fringes, those that are addicted, those that have been taken away from their families. That's really what is in our mission, and to treat these people as children of God. So I think we're doing that. The second reason for our success, I would absolutely, what that video shows, the unbelievable collaboration within our community. It is, I've never seen anything like it before in my life. When we go to share our program with other communities, we'll show up with our team of people, and there might be a nurse and a pharmacist sitting at the table thinking, all right, we're here, let's roll, let's get this thing figured out. And it's like, you know what, this takes an entire team, and we've had that in Little Falls. So I think that's been very good. Every community stakeholder's involved, and I think we're just at the tip of the iceberg. To sum this up, we know we have more work to do in our jails. We're the first in the county. We're the first county in Minnesota where we actually treat addicts while they're in jail. So if somebody's on Suboxone in our program and they're going in to serve a prior conviction, we're able to help administer their Suboxone so they're not going through withdrawals. We're actually helping addicts who first hit the jail come in and start doing that treatment, which is saving the jail time, which is really, kind of pioneering something that has been pretty skeptical amongst jails. So we're really proud to do that. I think our next work is we're working with the Mille Lacs Health System to the east of us, and we're working with the Ojibwe tribe and basically the band of Chippewa over there, and helping with babies with NAS and neonatal abstinence syndrome, and developing a partnership with them so that we can deliver those babies and provide a center of care for them. So again, ripple effects of opioids. And then I would just say also, definitely another ripple effect, and all these things are going to be happening. So everybody who's just starting this opioid program right now, like it's starting something new, just get ready for 5 years of a heck of a lot of work by all of us in this room. Helping public health and social services with displaced children. 95% of the displaced children in our county come from parents who are addicts or who have to go serve prior terms and prior sentences. So that's coming. That's another thing that's coming. So to end it, we have a lot of work to do. We'll definitely celebrate this award. I can barely lift the thing, which is kind of cool. And then thanks to my wife, Kayla. She raises 3 extremely wild 10, 7, and 2-year-old daughters at home. So I'm completely outnumbered. I barely have time to do this work, but she's my godsend, so thank you.